Hi, this is Sangeeta. Welcome to another OET speaking session. With me is Madan and he will take up the role of the nurse. Today we will see how Madan deals with the patient in the psychiatric ward. So Madan, you'll be talking to a 32-year-old patient diagnosed with bipolar disorder. When conducting a therapy session, you find out that the patient is not complying with medication regimen. So your tasks: first, discuss the condition with the patient. 2, find out details about non-compliance. And 3, offer solutions to the problem. Okay. So you have 3 minutes to prepare and your preparation time starts now. So Madan, you have 5 minutes for the role play. I'll stop you when your time's up.
Okay.
Shall we begin?
Yes.
Okay.
Fine. Good morning.
Good morning.
My name is Madan. I'm one of the nurses. I'm here to talk to you. Are you okay?
Yeah, I think so.
Fine. How are you feeling today?
I feel really sleepy.
All right. So I just wanted to discuss something more about your disease condition and about your medication. Is that okay for you?
I feel a little sleepy. Do you think we can talk maybe later?
Yeah, we can, but I think it's better if we can talk now, because I think I should know how you're doing and how the medications are working, and also I want to know how your mood is. So is it okay if I continue with this, please?
If you really think so, okay, fine, but I hope it doesn't take long.
No, it will not.
Okay.
It will take only 5 to 10 minutes. Okay?
Oh, then go ahead, please.
Fine. Yeah, first of all, as you know, you are having a bipolar disorder, and do you know that? Or
yes, I'm aware of it.
okay, fine. So how's your mood now? Are you managing well? How you feel exactly?
I wish I could manage it well. I don't know.
Fine. I can feel that you are not very happy or not in a very good mood. Am I correct?
Yeah, like I said, I'm feeling really tired and sleepy.
Okay.
I want to sleep for like many hours together.
Fine. Did you sleep last night, or is just sleepy after taking medications?
I don't know. I didn't take medications last night.
Oh, is it? Well, I think let me ask you some of the more questions related to your medication, if you don't mind. Can I?
Okay.
Okay, you said you're not taking medications and you did not take medication last night. Can I ask which medication you did not take, and are you not taking regularly, or are you taking
I don't know, like, some medicine that I'm supposed to take in the evening or something.
Okay, you're not very sure when to take your medication, you mean to say?
Yeah.
Well, I think I'll give you a complete leaflet and the information related to medication regimen, and also we'll make sure that you are given medications, whatever necessary in a particular time.
But see, like, I've taken the medicines for 5 days already.
Oh, yes.
There's no improvement. I mean,
Okay.
why should I take medicines if it doesn't work?
Fine, I understand your concern, but the thing is, usually medication takes longer time to take action, and you will feel the difference only after some time. You will not feel, maybe it's not just too early getting to to expect the outcome from the medication. And very important thing is, you should be adherent and you should follow the regimen, what we say, and also
But you know that, right? When I take the medicine, I feel very sleepy, very tired all the time.
Yes, I know.
And I don't get sufficient time to sleep.
Well, I think we can. I can discuss this issue with your prescriber again. We'll see if we can change your medications a bit, and maybe which is going to be very helpful for you. Maybe we can change your sleeping tablets and other medication to the night time. But I just wanted to know, like, how many medications you're not taking, or are you just not taking medications at all? And what do you do with your medication?
I try to avoid it because like I said, I noticed the last 5 days nothing has happened.
Okay.
Yesterday night I didn't just take my medicine. There's nothing wrong with me. So I think I can
Okay.
continue that way.
Fine. See, you just have to understand one of the conditions with your disease as well, because sometimes you feel okay, sometimes you may feel quite depressed as well. So just to maintain your condition within your normal limits, you should take medication very properly and in a very as per the regime. And even if you feel okay, it's better if you can manage, or if you can take the tablets as given to you in a particular time. And also, as I told you, we'll discuss more about the medication with the prescriber, and I'll come back to you regarding, as you have side effects of, you have sleepy, you're feeling sleepy.
Yeah.
So I'll talk to this about, regarding this to the prescriber. Okay, we'll find out a solution for that. But at the same time, you need to help me, or you need to help us by involving yourself in some of the actions, as well as you need to take your medication very properly. I'm just emphasizing more on that part. Are you able to follow what I'm saying?
Yeah, but see, I didn't take the medicine yesterday and I feel so much better today.
Okay. Yeah, but at the same time, what you do with your medication?
Yes, Madan, thank you. That's the end of your speaking time.
Thank you.
You've just seen Madan take up the role of a nurse of a psychiatric ward. So let's get to the feedback. Madan is already a very strong candidate. So if you see, his speaking is quite clear with all the grammatical errors. That means there aren't too many errors as such. He's got very good control over his voice, and his control over the conversation is also quite impressive. So overall, Madan's performance, I would say, is really good. There are certain suggestions that I would like to give Madan. So that will be the feedback of this video. Some of the things I've noticed is, one, initially when he asked me if I am ready to speak with him, I did convey my non-availability by saying that I'm really sleepy and that I would like to sleep. So I just thought the way he tried to convince the patient was not very strong enough. Like he said, I think we should talk right now. That's what he said. Probably what he could have done is he could have sympathized, saying, oh, I'm very sorry to disturb you when you really want to sleep, but there are certain things I would like to know immediately which will help us in our therapy, so could you please cooperate with me? That would have been a much better way of trying to convince me. Instead he said, no, I think we should talk now. So I just thought that area of convincing was a little weak. So probably you could have just put it across a little better. Okay, so that is one suggestion that I have. Second, outrightly he asked me, you're suffering from bipolar disorder. Do you know that? So it is right that it is very good to be transparent with the patient, so that there's nothing that you hide from the patient, and the patient clearly knows of his condition, and that's the best way a nurse can help him during the treatment. My only suggestion to Madan would be, instead of directly asking, you suffer from this condition, are you aware of it? Probably he could have first checked with me regarding my medication habit. He could have checked, when did I take medicines last, and do I take medicines regularly? And then when I do not accept, or if I don't comply with the regimen that I need to follow, then probably he could have checked with me that whether I'm aware that I'm a patient suffering from bipolar disorder. So that would have been a better way of putting that disease condition across, and then discussing, saying, see, you're very aware of this condition, and you know that without medicines this condition cannot be treated. So it's very important that you help us, and in a way you're helping yourself also when you comply with the medicines that we give you. So probably that should have been a better way of putting across my disease condition. So there's a small suggestion that I have. Instead of directly asking whether I'm aware that I have this bipolar disease or a condition, he could have gotten by checking out my background on my habits of taking the medicines, and how well I'm improving, or what my condition right now is, and then getting to discuss about my condition. So I just thought that would have been a much better, a more effective way. Other than that, I just noticed another flaw, and that is when he asked me about my habits of taking medicines, I didn't mention that I didn't take the medications last night. So instead of checking me why I didn't take, he just said, "Oh, can I ask you more questions regarding your medicines and your habits of taking medicines?" So I felt probably there immediately he could have checked with me for why I'm not taking the medicines, what my real reasons are. So probably he didn't need to have an introduction there saying, "Can I ask for the questions about medicines?" Instead he could have directly responded, So that again shows that you're keenly listening to your patient. So a small correction or a suggestion there where he didn't have to really introduce what he was going to talk about. Instead, my response was about not taking medicines on time. So he could have directly gotten to asking the reasons for not taking the medicines. So these are certain suggestions that I have for Madan. Other than that, I just felt in certain parts of the conversation, repeatedly he was asking quite the same questions. Like he began with taking medicines and why I'm not taking on time. He kept asking that a couple of times also ahead of the conversation. So I just felt that the repetition could have been avoided. Overall, I would say Madan's control over the conversation was really good, except the way he asked certain other questions. I just felt there were areas where he was asking questions, stacked questions. Like there were 3 or 4 questions that he asked at the same time. For example, he said, "How many medicines you're taking? How many are you not taking on time? When are you taking the medicines?" So I would like to know all these answers. So it's very difficult for a patient if you ask 2, 3 or 4 questions at one stretch, because anyone would be confused. What should I answer first? Should I answer the questions in the order? Should I just answer the last question? So to avoid all such confusions, all you need to do is ask a single simple question to the patient. Maybe you have 10 questions in mind, but you cannot ask all the 10 at a stretch. Ask one by one. Put them into categories or into stages. And probably one question will directly lead you to the other questions, or the response of the patient itself will lead you for further follow-up questions. So you should keep in mind not to ask 2, 3 or 4 questions at a stretch. It should just be a single simple question that you ask the patient and get responses accordingly. So these are my suggestions to Madan, and some areas where he could have improved in the speaking. But overall, I would really say that Madan's voice, his control, the way he was having the conversation with the patient, and the attitude that he had towards the patient was all really very good. Other than these small corrections that he could have incorporated. So thanks for watching, and hope this video really helped you.